Good morning, Steve Stites, Chief Medical Officer here at the University of Kansas Medical Center, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this Monday morning. Wow, what a great weekend. It actually felt like summer was here. So enjoyed that feeling to be back in the air again, and delighted to be back here in the studio with my good friend Dana Hawkinson, our Medical Director of Infection Control. We are joined this morning by the Executive Director for the Cooperating School Districts of Greater Kansas City, Dr. Kenny Southwick. He is back. He's been with us before. He's going to help us have an update on the impact of the CDC changes in masking and social distancing on the end of the school year. We're also going to hear from some Ruskin High School students on changing guidelines and vaccinations. So, Hawk, last week, toward the end of the week, man, things are going pretty well. Then it started to trend up just a little bit. How do we do over the weekend?
You know, we're great right now.
We are great.
You know, the health system has 4 active infections, 1 in the ICU, but none on the ventilator. So 4 actives, 6 additional, so a total of 10 patients in the hospital with a COVID diagnosis, which is pretty low, is really, really good. I think we're happy about that. Hays has just 1 in recovery. But overall, I think in the United States, we're continuing to see lower amounts of cases for one reason or another. But just as you talked about the last couple of weeks, it's not just cases, because we do understand that people are weary, may not want to get tested, but it is that hospitalization. So we will continue to track hospitalizations here at our health system, locally, and then around the nation.
And just to say, there was a report this morning when I was listening to National Public Radio, and there were some folks being interviewed from Kansas. And they were talking about how now over 50% of adult Kansans are fully vaccinated.
Yeah.
So that's great.
I think it's great that you brought that up. Exactly. 56% of Kansans of eligible population have had at least 1 dose, and just about 50% of the total population. So we're doing pretty well. There are many states that are less than we have, but we could be doing better. So
right, and I think that we're seeing the numbers drop. We think those numbers are going to continue to drop, which is great news. And you know, we're more than 2 weeks into a lot of opening, and so we're not seeing a huge influx of cases. So far, so good. What do you think about some of the information coming out about some of the different variants? I know there was some data that came out about the Delta variant, which is the one from India, being highly transmissible. And maybe it's looking like you will need your full vaccination to be fully immunized against that variant.
Yeah, you know, I think the vaccines are really going to be the continued way out of this. You know, a lot of with this, the new variants and is there worse disease, that has never been proven for any of these variants. Is there some immune evasion, or maybe the antibodies that we do have because of natural infection or vaccination may not be perfect and optimal, and so that may allow for maybe some of this increased transmissibility. But we also have to remember that during all of this time, a lot of places have been lifting restrictions. So there are people interacting more, able to spread the virus more. But what we are seeing is that with vaccination, especially with that second dose of those 2-dose regimens, you are having probably better protection. And that is because of the immune response that is elicited with those T cells, not just the antibodies, but that second component of the immune system, those T cells. In these vaccines, these 2-dose regimens, especially these mRNA 2-dose regimens, really seem to elicit an immune response. And then that booster is important to further drive that specific immune response as well.
Some more information also came out, published in the New England Journal last week, about the risk of thrombocytopenia and vaccine-induced thrombocytopenia, and even some clotting events that occur, especially with the adenoviral-based vaccines like J&J or AstraZeneca, but also now seeing some types of things, although perhaps less severe, with mRNA vaccines. Any thoughts about that?
You know, I mean, still, you know, investigating those things, but to your point, very rare or extremely rare events as well that are occurring, and we will continue to get more information and data about those.
Yeah, and they look less severe from what I've been reading with the mRNA-based vaccines, and but it also appears that the risk of death is going down, in part because we know there are some effective therapies for it, and in part because where I think just the awareness of it has led to better outcomes. So, you know, we're very hopeful, and I'm not overly concerned about that at all. I think at worst, the rate of cerebral venous thrombosis is 1 in 100,000, which, by the way, is the same rate as it is for an adult population in 1 year's time. So how much more these vaccines actually cause it is unclear. It may just be that we're finding it because we're looking for it, and because it's not clear that the rate has increased over the rate that's in the general population, and it's also not clear what the relationship could be. So we'll keep an eye on that. It's something well worth following, and if you're more interested in it, there's some really good discussion in the editorial from last week's New England Journal of Medicine that is free and open to the public because it's around COVID-19. So let's see if there are any reporter questions this morning before we jump into our discussion with Dr. Southwick.
Hey, good morning. Cody Holyoke with KMBC.
Hey, Cody.
Hey, thank you. A couple questions for you. As we're starting to see vaccinations, at least the rate wane in some places around the country, it looks like we might not make it to that presidential goal of 70% of adults at least one dose by July 4th. I'm curious, because you guys have your hand in the vaccination efforts in Kansas, what you're seeing behind the scenes. Is more being done or efforts ramping up? How are you trying to attack that?
Yeah, we are, and we'll be talking about some pretty cool stuff we're going to do here at KU in a future program, so stay tuned for that. But we are going to take a fairly novel approach to trying to get more people vaccinated, because the simple truth is we're not getting as many people vaccinated right now, and that's the disappointment. The numbers have fallen off. They've fallen off throughout the state. I think a lot of people are doing some things with mobile vaccination. That's one of the things we've tried to do. Listen, if you got somebody who's interested, you have a church, you have a school, you have a club, you have anything, you call us. We'll try and get over there and help you vaccinate. And I think we've heard Lee Norman on this program talking about going up to a dam on a reservoir and offering the fishermen vaccination. So we're going anywhere and everywhere we can to find people whose arms might be wanting to feel that vaccine needle, because we know that in the long run, that's what's really going to reduce the rate of COVID-19. So yes, I think there is a fall off. That is a real concern. That 70% goal looks a little bit in doubt. But I would also point out we've rallied before and we've been able to get more people involved. And I think continuing to carry the good message about the importance of vaccination, Hawkeye, I think that's the way to go.
That's all we can do, because at this point we know that demand is down, because everybody that had really wanted it has gone out and got it. It is readily accessible to everybody on either side of the state line. But there is continued hesitancy out there, and I see it in my own clinic. I saw it on Friday. A patient I had didn't want the vaccine because they didn't want the government telling them what to do. They still don't believe coronavirus is an impactful disease, and it's just influenza or a bad influenza. So there is still that hesitancy out there, and just like you said, we have to keep giving that good message. Really try to get everybody vaccinated as much as possible, because that is the way that we are going to keep on being able to do what we're doing right now, and hopefully not have those stories like we're seeing in the United Kingdom, where they are having second surges now, even with some vaccination.
And wasn't it wonderful to watch the crowd kind of all be together at the Royals games over the weekend?
Great.
I need to get out to Kaufman, but I sure loved watching it on the Royals broadcast. So.
Yeah, I think that first inning on Friday night should be enough to energize and get people through their whole weekend. It was so incredible.
So much fun. And then from your standpoint as well, it has to be hard as an infectious disease physician to have a patient talk to you and tell you that this is really influenza.
Yeah, it was really difficult, especially with all that we've been through. Just try to understand exactly, what are some of these people's thinking and reasoning. A lot of it is not based on true science or the reality. It is a lot of opinion. In addition to not believing, it's just asking them, talking with them, creating that dialogue. Well, if you don't believe coronavirus because you haven't had it, do you believe in AIDS or cancer because you haven't had those either? So it's just a matter of really kind of understanding and getting that dialogue going, and not getting emotional or angry, but just trying to present as much as you can present.
I think that makes good sense. Other questions, or Cody, did you have a follow-up?
Yeah, just one more question, kind of a news you can use question, as more people are going to the pool now that it's so darn hot out. Many of these kids haven't had access to the vaccine yet. I'm just curious if you had any tips for parents when it comes to the coronavirus.
Yeah, that is a great question, and thank you for that. That's why I'm going to give it to Hawkeye.
Yeah. I think still, the outdoors is safe. Even last year at the pools, you're outdoors. It's an open space. You're not catching it from the pool. It's an open space. But, with kids, we know they do like to roughhouse and be together. If you can still probably try to get a little bit of social distancing going on, that will be a helpful thing. But just continuing to be outdoors, I think, is the best thing. Obviously, wear sunscreen, but I think your overall chance of spreading it in those age groups, 12 and under, obviously everybody 12 and over should be getting vaccinated. But try to, maintain social distancing as much as possible. Further away is better. But other than that, I know that kids have been unable to do those things last year and for this past year, and so it is good to get out, but you have to make your own decisions and identify the risk and benefit there.
Yeah, I think that's exactly right. Gosh darn it, being outside,
Yeah.
we've demonstrated over and over again, being outside is a whole lot better.
Yeah.
Other questions? All right. Dr. Southwick, welcome back to our show. We're happy to have you. Hey, when the CDC changed masking and distancing guidelines, it unnerved a lot of folks, including high school students, at the same time they were presented with the opportunity to get vaccinated. Listen to what some high school students at Ruskin High School in the Hickman Mill School District were thinking at this stage of the pandemic. Let's take a look at that video, and then we'll go to Dr. Kenny Southwick.
We are continuing our candid COVID conversations, and this time we're talking to teenagers. Hi, I'm Anthony Nickens here at my alma mater, Ruskin High School in Kansas City, Missouri. We're talking to teenagers about how they feel about the current lifting of the masking mandates.
I don't feel safe at all, really. I think they should take their time. There's really no rush. It's really still affecting our communities.
No, that wasn't smart. People should all still be wearing masks until we figure out if the vaccination is actually working, and still wait till more people get it.
I feel like for some people it's dangerous for the ones that are easily prone to getting sick. For me, I don't get sick very easily, so I'm not really worried about it. Obviously, I still have to worry about getting it.
I don't feel safe. They said the mask mandate was dropped because for people that was vaccinated, but they can't tell who is vaccinated and who's not. Well, at first, like in the beginning when it first came out that it was not safe and that nobody should get it and it was like messed up by the government. But now I think that everybody's getting better with it and they like it.
My parents have been the biggest influencers on my decision. Just pretty much wait till all the kinks are done, like, get all the bad stuff out of it, make sure it's all working right.
I've heard that even getting the vaccine, you're sick for like a day or so, and you still have a little bit more of the symptoms. It's kind of concerning.
For the past, I say 2 to 3 weeks, they have actually favored the vaccine more. I have over 6 family members that had the vaccine that's doing just fine, and one of them being a former cancer patient. She's doing just fine as well.
Vaccines are currently available. Visit kansashealthsystem.com/vaccines for more information on the COVID-19 vaccines.
All right, well, those students look pretty darn good, and our own Anthony Nickens out there, a graduate at Ruskin High School. When I used to go back there in speech and debate, we called it Ruskin Heights High School, and they were always a really tough opponent. So, Dr. Southwick, tell us what you think about what those students had to say.
Well, first of all, I have to comment because I do every time you've got your tie on.
I
So
got
that tells
my
me things are
tie
getting better.
on. You know what? It's because
Yeah.
COVID's better, and we'd made the decision we were supposed to wear our ties back. So, but Hawkeye's on inpatient wards, and if I'm with him. If I was doing inpatient rounds, I wouldn't wear it, but I'll have to sit over in an office for a while. We're wearing them again.
No, that's great. I tell you what's better is to see those kids in school. The question with respect to what happened when the CDC hit, we worked really for about 13 months. Every 2 weeks, we'd pull the superintendents together from both sides of the line, Missouri and Kansas, and have conversations about how things were going. Started that in late April, May of last year. We were worried about how we were going to get kids fed, and this wasn't going to be that long. And then we know where we are now. But at that meeting, right prior to the CDC, we were just doing a straw poll, and everybody was going to wear masks till the end of the school year, and things were going well. Cases were down, quarantines were down in school. More kids were back in class. Everybody was feeling pretty good about it, but they were going to hang tight with their mask mandate. And then that recommendation came out, and immediately the community pressures were that, well, we've been asked to follow the CDC guidelines all along, and we're going to now follow those, and we're going to lift the mask order. And then right after that, it kind of changed again and said, well, we really didn't mean not wear masks. We still strongly recommend that you do in schools, which a few days later, as you can imagine, was continue to be confusing. What I tell you is that our school districts, all of them on both sides of the state, have done what they did the entire time. They took the information they had, they listened to what other school districts were going to do, and then they made their own decisions. So some of those districts continue to wear masks till the end of the school year. We're reevaluating for summer school. Some of them lifted them. I can tell you that right after it was lifted, one of our school districts had one of the graduations. It was supposed to be outside, and it rained, and it got moved inside. And the superintendent reported to me that the gym was packed, and maybe 15 or 20 people had a mask on. So that's a little bit alarming. We didn't just flip a switch with COVID-19 and now all of a sudden everything is okay. We have to look at how we got where we are right now and then try to analyze that. Meetings after that, I can tell you most of our schools are out. I think Belton has a STEAM elementary school that's still in session. Kansas City Public is going, I think, to the middle of June because they were late with in-person students. They had some hours that they needed to work with the state, I believe. But most of our schools are out and have already started summer school. And most of those, to my knowledge, they would recommend masks, but they're not making a mask mandate. So I think we'll have a little bit of a trial time here for the summertime to see, how we do and what the rates are. I would remind everybody, though, summer school numbers are not the same as normal school numbers. It's a lot easier to social distance kids in the summertime, outdoor activities and that than what it is obviously in the winter months. So it's just like we've always been, guys. It's day to day, we learn something. What we thought we knew last week may change this week, and we have to adapt.
Yeah, I think that's absolutely right. And I think that the good news is we can learn from each other, whether it's the Royals and the schools or an indoor meeting or what have you. I think we're all learning from each other. We do know, though, that the rules of infection control still keep you safe wherever you go, and wearing a mask can always be an okay thing. It doesn't have to only be a COVID thing. It can be a good thing for a lot of different reasons. Hey, at last check, you've been working hard with schools and having safe proms and graduations. Do you feel pretty good about how things went?
Yeah, I really do. We were able to get our graduations, majority of those out of the way. I've not had conversations with superintendent where there had been any kind of outbreak as a result of that. As you remember, last year we had several districts that had some sporting activities and some graduation parties where it led immediate to quarantines. But I haven't heard of any of that. I think as we move along, it's a little bit like the Royals and what you talked about. They're back together. The stadiums are full. We haven't heard anything yet. So we'll continue to monitor those. But a lot of those graduations are more than 2 weeks out. So we're feeling pretty good about it.
Yeah, I think that's right. So I think the next big thing is you've mentioned summer school, but then back for the fall. What do you think CDC guidelines will mean for getting back to school then? And what do you forecast? Is everybody going to be back full go? Will there be any hybrid learning? What do you see coming?
Yeah, I think that there will be some parents that will elect, and most of our school districts are going to continue to offer remote learning. Quite honestly, that's something that we did anyway. We didn't offer the full day remote, but we offered certain classes remote. The report from superintendents, though, those numbers are down. It was not uncommon to have 25 to 30% of our students that might have been in remote learning. And I'm hearing numbers more in the maybe 8 to 10%, maybe 12% that are going to elect that. And remember, there's homeschoolers that are out there that deliver curriculum and always have, so those numbers would also be counted. I think we are ready for the new normal. We just have to see what the summer presents us and what the guidelines are. I think we've proven what the guidelines are, we'll follow them. And whether that's with our local health departments, in conversations with them, with the CDC, that will tell us what we need to do. I think the new normal is we're probably still going to continue to social distance as much as we can. And I think good hand washing regimens have been in place for a long time. I think they'll continue to be emphasized. I think that's just healthy. We know that last year for those schools that were in place, wearing masks, doing all the mitigations, our influenza numbers, flu numbers were way down. So I think we've learned some things, but everybody, parents, community, school board members, administrators, teachers, students, we want to be back face to face. We know that's what's in the best interest of our kids.
Makes so much darn sense there. So the vaccination is our path out of this pandemic. Are you going to be working with cooperating schools on a campaign to encourage vaccination amongst our kids?
We started that conversation. I'm a little fuzzy on the numbers that we see in terms of Kansas and Missouri, and we're at 50%. And I don't know whether that includes our kids or not. I was in a conversation the other day with Children's Mercy, and I think they're working right now in the trials for infants to 12. So that information may come out and that be available. But I'm going to be honest, I'm a little bit nervous about, we flip this switch, everybody's feeling uncomfortable. If everything's going okay, do I really have to get my child vaccinated? And those parents have to make that decision. I can't tell them what to do. And the school systems, I don't believe, are going to be in any kind of situation where we're going to mandate vaccines. So what we have to do is continue to do what we do every day, and that's educate, give people the best information, the most accurate information, and hopefully they'll make the right decision. I'm going to speak personally. I agree with you. Vaccines are the way for us to get out of this, and it's a way for us to ensure that school can go back in session in the fall, and it can be uninterrupted, that we won't see quarantines of classes and teachers and staff. So we need to continue to encourage. I don't think we can do it by ourselves. I hope we can partner with different groups, whether it be KU Med Center or Children's Mercy or the Chamber or local television stations, to continue the information out to encourage the vaccinations. Because I'm afraid if we don't and we end up having to make an adjustment to the school year, it's not going to be good for parents, families, students, not good for the economy. This is me, get the vaccination.
All right, so sounds right. Hawkeye, what do you see coming out data-wise between now and the beginning of the school year? Do you anticipate any new information?
You know, I think that we are going to continue to see that the vaccines hold a lot better immunity than previous natural infection. And we will just continue to see that they will give you protection. And I think if we're talking about, young people and being able to participate in extracurricular activities, whether that's sports or debate, if they don't want to be held out of that participation because of a positive COVID test, the way to prevent that is getting vaccination. And we saw those young people in their opinions on the vaccine. And it is very difficult to get into those households because there were a couple of those students had talked about what their parents had told them and wait till the kinks are worked out and things of that nature. So it does, begin in the schools and at home, and continuing to give that message and really work through those concerns of those young people. But the way to continue to be able to go to school, to continue to be able to do extracurricular activities and not miss participation days because you have a positive COVID test, is to do the vaccination. And I think as we move further into this, the new data will continue to support that you are going to be protected. you are not going to be able to transmit the disease if you've gotten vaccination.
Yeah, I think that's exactly right. And and just to say, we have that ongoing debate about whether or not vaccinations are safe. Just remember that in the 23rd century, you're going to get the diagnosis, develop a vaccine, receive the vaccination, and get better all within 1 hour episode of Star Trek. So this is really not all that fast. It just feels fast relative to other things.
Yeah.
And with that brilliant insight, Jill, let's go to questions from the community.
All right, Carolyn is writing in this morning, and she's coming to us from Lake Milford. She wants to know, if you are asymptomatic and start the vaccine series for COVID, what happens inside your body?
Okay, good question, Hawkeye. What does happen inside your body? I think it's going to be the same thing that happens inside your body, even if you don't have COVID right then.
Yeah, you're just going to start to ramp up those B cells and T cells, creating that immunity.
And what we know is if you've had COVID and you get even one shot of the vaccination, of say the 2-shot regimen like Moderna or Pfizer, you end up having some really significantly high antibody levels and appears to be very long-standing immunity.
Yeah, absolutely. And the immunity, at this point from vaccination, as compared to natural infection, we are looking at that, lasting at least a year. If you are going to need a booster, when is that going to be? I probably don't anticipate anything before a year, unless there is a new concern, say a new variant or something like that. But we know Moderna is right now in trials with a new vaccine or a booster, which is directed at that South African variant as well. And it looks to produce very good immunity and have good results.
Amber and Terrell's question is very similar. It's, what is the risk of, Amber says, going inside a store with children under 12, now that many people inside are unmasked and potentially many of those could be unvaccinated? And Terrell is asking, are kids more vulnerable now for catching COVID?
I don't know if they're more vulnerable.
say
What do you
more.
think? It's actually less vulnerable just because there's not probably as much circulating COVID in the community. But what do you think?
Yeah, I don't think they're more vulnerable, but certainly if they are not vaccinated, they are just as vulnerable as anybody is to getting it. We know that. We know that children, although, thankfully don't have the same symptoms or the severity of symptoms in general as compared to adults, they can still reproduce as much virus and spread the virus as well. So, but I think your risk for something in a store is less. We do know that stores still encourage masking, and I would still encourage masking if possible, if you can do that. But I don't think that their ability to get the virus is any less. It's kind of just the same as it always was. It's just a new host that doesn't have any immunity.
Shannon wants to know, what if you're unable to get the vaccine? Does that mean you can no longer live a free life?
Well,
Why
first of
couldn't
all,
you
I think
get
most
it?
people can get the vaccine. There's
Yeah,
very limited
very
to people
rare.
who have had anaphylaxis to some other
Yeah.
like materials that may not be. But even then, we recommend getting the vaccine. You just do it in a very supervised setting, and you may even have some other medical medications available or having been pre-treated before getting the vaccination. So talk to us about that. I'm not sure.
Yeah, it's an extremely rare circumstance that you are unable to get a vaccination. Even if you have food allergies or other allergies to medicines, you can still get this vaccination. So it's unclear exactly what, and that is unless you had a significant reaction to the first dose, that it would be contraindicated. So I think working with your medical team to really identify what is the true nature of the problem, because there are few, if any, real contraindications to being able to get the vaccine.
And I would say even at certain ages, if you get COVID and you get sick at all, you can still get the monoclonal antibody therapy, which we know is really helpful in
Yeah.
helping preventing hospitalization and death. So there is an alternative. And I would say to you, if you define a free life as being willing to take on the risks and not wear a mask, then you're going to be taking on a little bit more risk if you can't get the vaccination. There's just no two ways about that right now, especially as we see the rise of these different variants. However, remember that throughout this pandemic, we have kept our staff safe by wearing masks in the hospital ward. So yes, you may have to still wear a mask. It does help keep you safe, and it helps keep other people safe as well. So yes, it's not complete freedom. I get that. It is truly not complete freedom. But I would encourage you to make sure that there's no way you can get a vaccination. If there is no way you can get a vaccination, I encourage you to watch carefully the data on the monoclonal antibodies, because I think it's even loosened up a little bit now from where we started, and that is very effective therapy as well.
Norma says, I know some people who had the J&J vaccine. Are there guidelines for a second dose?
Boy, I don't think those
yet.
guidelines are out yet. We
Nope.
do expect to see some data, perhaps in July, where J&J publishes the results or talks about the results of their 2-shot regimen, which they've also been in trials comparing it to a 1-shot regimen. I think that'll give us more information, Hawkeye.
Yeah, and we think that early data from the mixing studies, so in the UK looking at AstraZeneca paired with Pfizer doses, look to have very safe, and also look to have high antibody levels, at least in what they're looking at for that data. But that's early data. So I think eventually, if it's not a 2-dose regimen with Johnson & Johnson, you may be able to mix some of these vaccines as well. And I think it will go in that direction, just because hopefully there will be 3 or 4 vaccines available for people here in the United States. And so you won't always understand exactly which one you have or had. Maybe you lost your card or lost the record. So you'll be able to get a booster, or you'll be able to get those other doses with those mixing things. But right now, to that question, I don't think there's any data about the 2-dose.
I think that's a really important point, because the NIH has started a study looking at a Moderna second shot after you've had different kinds of first shots and seeing what the level of effectiveness is. And they've got another study looking at all sorts of different combinations. So I think we're going to have a lot more information again, we're building the airplane while we fly it, but we've clearly gained altitude over the year.
Yeah.
And I think we're in much better shape. And so I believe that we'll have a lot more information around this very question about the J&J regimen, hopefully within the next few months.
Katie and Mary are concerned about Lynn County and Livingston County in Missouri and what impact that might have on the metro in Kansas.
Yeah, always worried about Hawkeye, those counties
Yeah.
which have a higher rates where masking wasn't as good to begin with, and vaccination's not great, and then they get different reasons to have an outbreak, and whether or not spreading from those folks will go elsewhere. What are your thoughts?
Yeah, I mean, I think overall you won't see a large impact moving to those more vaccinated counties or areas. There will be hot spots around, and again, I think it will be determined really by vaccination rate. I think that's the end-all, be-all there. So if we can continue to encourage the vaccinations, hopefully in those counties, there will be more uptake now as people see and understand what is happening, and if they are impacted, they will see more of an uptake of the vaccinations. But I don't see that impacting Kansas City or the Kansas City community directly. But certainly we know that people can move back and forth and certainly spread it, but I don't think we will see a large impact to the extent that those counties are seeing it.
That's a great question. Let's turn to Dr. Southwick for just a minute. So, Dr. Southwick, are you seeing wide variations in the rate of vaccination between different schools or different districts?
I would say by and large it's slow across all of them. We've had some of our districts that have held vaccination days, vaccination events, and they've been excited that they've been able to get students vaccinated, but we feel like overall population, it's pretty low. On the Missouri side, we represent 187,000 kids across 32 school districts, and then we've worked with all of those in Johnson County and Wyandotte County as well. And there's just a lot of kids that we have to get vaccinated, and I'm really curious of where we think we are percentage-wise with those. And it's some of it is health consciousness from parents, don't know what the long-term effects might be. Who knows what they've read or who they've talked to. The other part of it is I'm not getting it, so my kids are not getting it. And if we're slowing down at 50% in the country, you got to figure that if they have children, that's the influence, and they have to sign for the kids to get the vaccine. So it gives me pause for sure in terms of us being able to move forward.
Yeah, how do we get how are we going to, we got to win this battle, Hawk.
Yeah, that's true, and we need to, and we heard it there. We heard it on those young people when they were talking about that, and it does start in the home. It also starts with the information that they are getting themselves individually, whether it's from social media or the mainstream media or whoever their source of truth may be. We are fighting against that if there are those, if they are looking at those misinformation campaigns. And so I think it's very concerning. I would agree with Dr. Southwick.
I have a question if I could ask. This is a personal question. I've thought about this. If we get kids and staff members vaccinated and we start school and we do have a case in a class or in a school and we're forced to go to quarantine, do you think that the local health departments of the CDC would say, if you're in that class and you're vaccinated as a staff member or a student, you don't have to isolate or quarantine, only those that aren't vaccinated?
Well, I think that's
I know that's kind of an out there
that's
question.
That's a great question.
Yeah.
Hawkeye, I'm not exactly sure how that will turn out.
Yep.
I think it's one reason, obviously, to continue the hybrid learning model, but there might be some early data suggesting that if you're vaccinated and you've come in contact, you don't have to isolate.
Yeah, we know the new guidance for fully vaccinated is that you exactly what you said. Those are for social situations, but how will that translate into a workplace or a school situation is something different. I don't think we've seen guidance on that, but just like you said, if you are known to be fully vaccinated and you do come into contact, you don't have to quarantine. You just monitor for symptoms. Again, that is in a social context, not a school place setting. But as we get further into this, there may be new guidance coming from the CDC about that.
I'm going to bet, here's my guess, I'm going to bet that if you've been fully vaccinated, you're not going to have to isolate. I think that's where we're going to land. I think we're going to see that's the infection dynamic unless the Delta variant or one of these other variants comes along and causes disruption to that message. But I bet that'll be the guidance because I think that's how the disease is acting in the community today with our drop so significantly in hospitalizations.
That might be the motivation to get vaccinated.
I'm all about that. So, Jill, we have time for one, maybe more, two. Let's go see if we have.
Okay, Isaac wants to know, what are the chances that some school districts will adopt masks again in the fall, if not for COVID, then at least because of the flu season and other people weren't getting sick? Isaac also wanted to know if you know how many episodes it's been since we had somebody on a vent. Because he thinks it's been at least 3 or 4.
Oh, we'll find out that question. That's a good answer. We'll talk to Amanda and get that answer. I think it was last week. We did have a death recently, but that was a person who had been sick for a while with COVID-19. So, but let's go back and find out that vent. And to the first question, ask that one again.
I'm sorry that I did that to you.
That's okay.
It was about masking in the fall.
Yeah,
being
yeah.
A
Do we
good
think
reason.
are we going to wear masks again in the fall? I'm going to bet, Dr. Southwick, there's very little energy around that in the schools. What do you think?
I would agree with you. I think, again, we're going to probably follow recommendations, which are going to mean they may be recommended. They're going to be allowed for personal choice, but they're not going to be mandated. I think we'd have to get into some major event like we did last fall and into the winter before you're going to see major mask mandating across our districts. Now, we're not there yet. We don't know what things are going to look like in August, but as I say right now, that'd be my prediction.
And I would just add, the one thing you might try to do is encourage anybody who's even got a cold or sniffle who thinks they can go to school, hey, try to stay home and hybrid learn. But if you're going to go to school, be responsible, wear a mask, keep everybody safe. That way you keep them safe against everything because you don't spread something even like a rhinovirus or an influenza virus out into your school. Hey, tomorrow we welcome back welcome back our KDHE Secretary, Dr. Lee Norman, here in the studio. And joining us for the first time in the studio will be U.S.-Kansas Representative Sharice Davis. We're going to talk to them about the state of COVID and what's going on. So start sending your questions now because I think that's going to be a really, really fun program.
And Sharice Davids.
Sharice Davids, thank you. Sorry.
Not Davis, but David.
You know what? I always do that. Sharice Davids.
That's
I don't even know why.
I know.
Because it's spelled D-A-V-I-D-S, not, There you go. All right, final thoughts. Dr. Southwick.
Well, I just think that we'll continue to see how summer goes. As always, I want to thank what you all do. It's helped us tremendously to kind of weekly be able to keep track of what's going on, get our questions answered, make decisions. We just got to get back next year. We can't lose another year where kids aren't in classrooms with their teachers, with their friends. So just have to be diligent, continue to work on vaccines, and all work together.
Yeah, I think that's right. Well, thank you, by the way, for your service and the great work you've done. I think this has been such a hard year. You know, we had family dinner last night. We were sitting around talking about the year, and my kids are out of school now. But we all actually, the two of them were doing their master's programs last year during COVID. They both reflected on how much harder that was in district or being in school learning, and how much harder it was to not have those social interactions. I can't imagine for teenagers and younger kids. I just think this has been the year of absence, and I don't think we're going to miss it. Hawkeye, final thoughts.
You know, I agree. I want to thank our guests for sure, and I totally agree with that. You know, schools are safe places. They provide opportunities for social interaction, for meals, all of that. Better learning. We certainly know online learning for 5, 6, 7 hours a day is very difficult. Hopefully we can continue to have schools open, have the children participate in classroom learning. The way that we are going to be able to continue to do that and not see these surges, as other countries are seeing surges as they are opening up, is to continue to vaccinate. And right now, anybody 12 and older should be getting vaccinated. We'll continue to do that, and hopefully within the next 1 to 2 months, we'll see that even kids much younger than that can be vaccinated as well.
A year of absence, unlike any other. That has to be one of the hardest things we've all ever experienced collectively, and I hope that we can always be together. But remember, the way we do that is to not bury our heads in the sand. It's not to simply say, it's not going to get me. It's to recognize that the way out of this crisis is the same way we've been able to conquer polio and smallpox and other deadly scourges of mankind that led to such pain and suffering and toil. And that way, of course, is through vaccination. Let's make the year of absence a memory and not a future. We'll see you tomorrow.